Hi, my name is Scarlett Devaney. I'm a physician assistant at Georgia Plastic and Reconstructive Surgery.
And my name is Majida Aydin. I am one of the estheticians down in Amachi Medspa.
And we're here to talk to you about different options to tighten your loose skin. The first, that is minimally invasive, is called ThermiTight. ThermiTight is injectable RF. We have a small probe that goes underneath your skin and helps kill a small layer of fat, as well as help your skin tighten up over time and retract back. Similar to when you put bacon on a stove, it shrivels up. We want your skin to get smaller and closer over time. It works on many areas of the body. We love breasts and even your thighs. So it's really great to use all over the body. Do ThermiTight procedures all the time. Without having to go to sleep. Hardly have any pain during the procedure. And what else can I answer about that?
So one of our Facebook friends wanted to know
on tightening the skin is liposuction. We can incorporate it with liposuction, and a few photos here of different when they also had ThermiTight. And I think this patient is another great example. We use ThermiTight so she has no long scar over her shoulder.
Thermi breast. When do you know whenever you're a candidate for the Thermi breast in comparison to a breast?
Is really just going to change most. It's not going to give you a dramatic change that usually our patients are.
Logistics behind it. Do you have to, like, about how much time off of work? Do you have to wear a
and just to kind of allow yourself to get used to the feeling of being a little bit swollen. But then you can kind of head back to work right after that. You will be swollen for about a week. So if you're getting this for the first 6 weeks after surgery.
Okay, and one of our most popular Facebook videos, Facebook Lives, was whenever we did Thermi butt in combination with the butt reduction.
Yeah.
So let's say somebody wants to do like a tummy tuck, would they combine ThermiTight with that?
That's a great question as well. So ThermiTight is great for loose skin. It's not great for excess skin, and that's a problem that happens, you know, usually after you have some babies or a C-section. We have loose usually our patients above the age of 55 or 65 are interested in getting some tightening of their chin and neck, and usually at that age we need a little bit more help and a little bit more help in terms of a mini facelift, lower facelift. So ThermiTight is a great alternative, but it's not the gold standard with removing excess skin.
Okay, and one of our Instagram friends wants to know, does this require any kind of
puncture holes? They are teeny tiny and they heal really, really well. There's nothing. And Dr. Coro and Dr. Park are highly trained. They'll hide them in folds of your skin if you have any of those, or behind your hair, things like that. So we take that really important.
Okay, and so if they don't want anything that's going to be like invasive or that's going to puncture them at all, what are some of those other options?
Well, we can do and use technology, so radio frequency technology on the surface of the skin. And we have that at Amachi Medspa. It's called ThermiSmooth.
Yes. So this is where I'm going to take over. I'm going to talk about all of the non-surgical skin tightening treatments. Even though ThermiTight is minimally invasive, we do have some Thermi systems in the spa that are non-invasive at all, non-surgical. We also do Ultherapy, which is non-invasive. So let's go to the Ultherapy to ThermiSmooth. And I want to know what the difference is. Well, this is Ultherapy. It is an ultrasound wave. It does hit certain collagen. We'll use Ultherapy because after an Ultherapy treatment, your body's going to stimulate its own collagen and you won't need any more. Ultherapy does get a lot hotter than the Thermi will. It gets about 70 degrees Celsius, while Thermi only gets about 45 to 47 degrees Celsius. So Ultherapy, because it does get a little bit hotter and it does go to those different levels or layers, it is a little more uncomfortable than the Thermi would be. This is just an example. It says 180 days after, because after your Ultherapy, you are going to feel the tightness right away. Results about 90 days after, and you'll continue to see results.
And do you have to use a garment or anything like that with the Ultherapy?
You don't have to use a garment. I mean, it will kind of help because as the skin is trying to retract, the garment kind of compresses the area, so it can help, but it's not mandatory to use a garment after Ultherapy or Thermi.
And what are the treatment areas? Like, what can we get with the Ultherapy?
So with Ultherapy, you can treat your entire face, your upper face, your lower face. You can also treat your décolletage area.
So it's not possible to do that on the body for somebody who wants like...
Not yet. The skin on the lower body is a little bit thicker than the skin on the face and the skin on the neck. So treatment in those areas would be off-label, so we don't really recommend it.
Okay. And can you explain a little bit more the technology behind Ultherapy versus the Thermi, like the radio frequency versus the...
Yes. So radio frequency is what Thermi uses. Radio frequency does go a little bit deeper, but it's not as controlled as an ultrasound wave would be. And it does different things. So Ultherapy kind of shocks the tissue. And when it shocks the tissue, it causes the tissue to heal itself and it stimulates the collagen. The Thermi, whether it's ThermiSmooth or Thermi for the face, it uses radio frequency, which is a wave, another wave, but it's a continuous current, so it uses heat. It's very comfortable. It takes the skin about to 47 or 45 degrees Celsius. Doesn't get as hot as Ultherapy, so most patients compare it to a hot stone massage. Most patients end up falling asleep while they get the treatment. It is multiple treatments. It's about 6 sessions, which is what's recommended for a full result. And you can get the sessions either once a week or you can get them twice a week. So it just depends on how much skin we're trying to address, if we're trying to induce collagen, that sort of thing.
Okay, and do you combine that with can you combine the Ultherapy with the ThermiTight, the Thermi with what do you combine? What is the best combinations with those?
We wouldn't combine the two together. It's kind of like an either or. So when a patient comes in for their consult, we'll see what area they want to treat. Thermi can be treated all over the body. We can treat even the vaginal area with Thermi for skin tightening in that area. Ultherapy kind of stops at the chest area. So with Thermi, we can treat hands, we can treat abdomen, we can treat inner thighs. We can also treat cellulite. So Ultherapy doesn't really touch the cellulite. So it just depends on the areas and what the patient wants. We also pair Thermi with cool sculpting. So we call it fire and ice. So cool sculpting we did a couple of weeks ago. Cool sculpting is a non-invasive fat reduction. So it'll debulk the area, but it doesn't really do much for skin. So we'll compare cool sculpting with ThermiSmooth for the body, and then we'll get the skin reduction and the fat reduction at the same time.
Wow. Okay. All right. Do you guys want to move over and discuss the Thermi face?
Yes.
Yes.
Hello. So this is Majida. I'm back with Sheree. Sheree is one of our estheticians down in the spa. We are doing a Thermi face treatment right now. As I discussed, you can do Thermi all over the body, the face, the body, and we can also do Thermi for the vaginal area. We are doing our client's face. We're doing around her mouth. This handpiece, if you can see, is very small. It allows us to get in those smaller areas. So if you wanted to do the client's crow's feet, if you wanted to do the forehead, right now we're focusing on around the mouth. We can also do the laugh lines if you want to do a little more tightening there. And when we do the Thermi for around the mouth, it controls or it helps minimize those smoker lines. Even if a client or a patient doesn't necessarily smoke, if you drink from a straw, if you laugh a lot, if you make even like an O movement a lot, then you'll have those smoker lines. And of course, nobody wants that. So you'll come in and you'll get Thermi done to the face. Like I said, it is 6 treatments and it is done either weekly or you can do it twice a week. If you want quicker results, then I recommend doing the Thermi twice a week, and it is a total of 6 treatments.
And one of our Facebook friends wants to know the cost.
Well, it varies. So Thermi for the face, it starts at $9.99 per area. And if you're doing a crow's feet, it's not $9.99, $9.99. It's just $9.99 for the crow's feet. So it depends on how many areas you want. You can do your full face or you can customize your areas. If you want Thermi for the body, and the body is anywhere below the neck, it is $1,200 per area. And then we also do Thermiva, and that Thermiva is 3 treatments. It's still non-invasive, it's radio frequency, and Thermiva is about $2,500 right now for the special, for the package.
So is Thermiva non-invasive? Like, is that?
It's non-invasive. It uses radio frequency, so it's the same technology. It's actually the same boxes. This box right here, it does the same thing. It raises the temperature of the tissue. When that tissue is raised, it expands, and as it heals, it contracts, and that's what causes the tightness. So it's very comfortable. Thermiva takes about 30 to 45 minutes, depending on the level of skin laxity that we're trying to treat. And most patients fall asleep. Once they get comfortable, they end up falling asleep throughout the whole treatment.
So we have one more question about injectables. Like if you're getting Botox or fillers, can you still get a Thermi face package?
Yes, so I do have some clients that come in and they'll get fillers or they'll get an injectable like Botox. And in between times, just to prolong their look, they will come in for Thermi just to, you know, as the Botox starts to wear off or as your body starts to metabolize the fillers, you can come in for Thermi just to kind of encourage your body to hold on to that look a little bit longer.
And how long after your injectables can you receive Thermi?
It just depends on the type of injectable. Some injectables you don't want any pressure on the face. Some injectables you don't want to lay down. See if you are a candidate for your Thermi. No, it's very comfortable. Are you okay?
I'm fine.
All right. There you go.
Wonderful. So those treatment areas.
Lines. You can do your forehead, the creases in your forehead. We can do your crow's feet.
Yet, or maybe starting to develop them.
It can be a preventative. You don't want to do it once the treatment or once your lines are visible. You may need more treatments, but you can do it as a preventative. Yes.
Okay. Okay, well, thank you, Majida, and thank you, Sheree, and thank you, Model, for allowing us to watch this treatment. Let's get a closer look. at this. So she has that box, and she's using that probe all around her mouth. And it's going to help with those marionette lines, those laugh lines, smoker lips. And it's a really awesome preventative measure. Very cool. Bye, everyone.